Well, have you seen these billboards? It's in response to the increase in fentanyl deaths across the country and sadly here locally as well. There are a handful of these large signs up across Erie County. They went up earlier this month. The county's opiate task force is behind the billboards, encouraging people who use cocaine or crack to take turns and carry Narcan. Joining us live right now to discuss this is Cheryll Moore. She is the medical care administrator for the Erie County Department of Health. Thanks so much for coming on. You know, for those that might not be familiar with fentanyl and the scary kind of situation that it can create, how would you describe to our viewers about, how bad this is here in Erie County right now?
Thank you so much for having me. Right now in Erie County, the number of deaths are increasing, the same as across the country. This year so far, we have 108 confirmed deaths, and there's 104 that are still pending. We're awaiting the toxicology results. But based upon what we are seeing from the scenes where law enforcement and first responders are, we know that stimulants are involved. We know from the toxicology screens, many times they are cocaine or crack, other types of very social drugs, different people. They're unexpecting to see this very strong opioid in what they're getting, and they're dying.
At the bottom of the billboard, it's advertising free Narcan, which people might not even be aware of. Of course, it's the nose spray that you can use if somebody is overdosed. You think of all the lives that have been saved as a result of that. Why is it important for you to advertise, that this is free and to remind people of that? And have other communities had success in doing a sort of a marketing campaign like this?
I think we've been pretty proactive here in Erie County, and we've really been at the forefront. I do know in Utah, they've done a pretty aggressive marketing campaign about Narcan or naloxone, the generic name. We've really pushed it here to really get people to understand this is simply first aid. Narcan is no different than learning to put a tourniquet on, learning to put a Band-Aid on. It's a first aid tool. We revive people with it very much like an AED. It's not going to solve the problem of somebody's disease problem, which is substance use disorder, but it's going to get them breathing so that we can get them to treatment.
If anybody wants to get their hands on some of that free Narcan, I know that you're trying to make it just as easy as you can to do. So I want to show people something that you've put out there. People can text 716-225-5473 or even just scan the QR code that's kind of at the bottom right part of the screen right there. You pull out your cell phone, you go to the camera app, put it up there, and it'll take you right to the site. So we're going to leave this up, Cheryll, as you answer this next question. But what has been the response that you've seen so far, as I know this is still sort of a new campaign, but any early reaction?
It's really generated conversation, which was our goal. We want people to talk about this, to recognize that it's a problem in the community, that may be something that they see that they didn't realize that they saw. Cocaine and the stimulants are a little bit different drug than we saw in the past. We saw many people struggling with opioid pills. They transitioned to street drugs. And now all of our stimulants in our community, and as well as pills that are not coming from pharmacies, are adulterated with fentanyl. The more Narcan that is out there, the more opportunities are there to get people breathing once again. I can't reiterate enough, if someone isn't breathing, they can't get to treatment. And this is somebody. It is always somebody's loved one. People are being blindsided. They don't expect this really, really potent opioid to be in these substances that they have.
We were having this discussion earlier today, kind of at our editorial meeting before we reached out to talk to you about it. And somebody at the table brought up such an interesting question that I think a lot of people might ask about this, which is why is the fentanyl ending up in these drugs? And of course, it's not just cocaine and crack, as you're mentioning here, but other drugs as well. What is it about fentanyl that makes it end up in all of these drugs?
Fentanyl is a very strong opioid. It is something that people can develop a physical addiction to. 10 to 15% of the population has a predisposition. We know this. It's also very cheap. So when we talk about drug cartels, they're in it for the money. They don't care about people, and they are always looking for another customer. We care about our loved ones, our families, our friends, all of everybody that's in our community members. They don't care. They're in it for the money. They're in it to make money. And they always think, well, there's another customer. So honestly, working with our law enforcement partners, we've learned there's no altruism in our drug cartels. They're just out to make money. Our role here in community is to really keep our loved ones with us, to get the messaging out there to people, to get people that really have no idea what's going on out there. If you're not looking for this information, you probably wouldn't see it, which is why billboards are very good. They just simply bring awareness and they generate a lot of conversation in the community.
Yeah, exactly. You look up and you see that, and then you ask your friend, and then all of a sudden you're having this conversation that I know you believe is so important that people actually take some time and talk about it and think about it. Cheryll Moore is the medical care administrator for the Erie County Health Department and part of this opiate task force. Thanks so much for coming on the show and talking to us about this. It's very important.
Thank you so much for covering this, and we really appreciate it. Text for Narcan anytime. It will be in your home. We send it out within 24 hours.
Great to know. Cheryl, thank you. Have a good night.
Thank you. Have a great one. Take care.